Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Many phases of dental examination and treatment are enhanced by radiographs covering areas larger than that possible with intraoral films and having better definition than that currently available by panographic methods. With the addition of a few items of equipment and the utilization of proper procedures, successful extraoral radiography may be accomplished in the dental office. In this film, we will introduce and describe the additional equipment necessary for extraoral radiography. During exposure, the film is contained within a cassette. The cassette consists of a metal frame surrounding a thin panel of material that is opaque to visible light, but is readily penetrated by X-radiation. Lead letters fastened to the front panel are used to identify whether the radiograph is of the patient's right or left side. Lightly etched horizontal and vertical lines cross at and define the center of the front panel. On the back, the center is designated by this red dot. The back plate of the cassette is hinged to the frame and held tightly in place by the horizontal compression spring. The back is opened by pressing down on the ends and rotating the compression spring. On the inside of the back plate, there is a fluorescent or intensifying screen. Removing the film, we see that there is a similar fluorescent screen on the inside of the front panel. The film itself is a special screen-type film and has an emulsion layer on either side. With the cassette closed, note that in addition to the red dot marking the center of the back plate, there are also red dots on the leading and upper edges of the cassette. These correspond to the vertical and horizontal centers of the film and will be used as guides for placement of the cassette when preparing for exposure. With this setup, the function of the fluorescent screens in the cassette is illustrated. The remnants of the X-ray beam that pass through the patient excite the fluorescent screen, and the X-radiation is converted into visible light. The light is of a color to which the film is most sensitive. If the back plate of the cassette were closed, the rear screen would also be caused to fluoresce, increasing the intensity of the exposure. Since the film is much more sensitive to visible light than X-radiation, the use of the cassette reduces the exposure time and the radiation exposure of the patient. Although definition of detail suffers slightly, contrast is enhanced. In preparation for taking an extraoral radiograph, the cassette is loaded in a darkened room, illuminated only with an appropriate safe light. An unexposed film is carefully removed from the package, placed in the cassette, and locked in position with closure of the back plate and compression spring. The loaded cassette is now ready to use. This is an example of the standard lateral jaw radiograph. The center of the X-ray beam was directed at the occlusal surfaces of the first molars. The objective in this film was to expose the maxillary molars and their supporting structures, and likewise the mandibular molar and bicuspid areas, without the superimposition of images of other structures. The inferior border of the left mandible, outlined here, is well out of the way. This is the image of the spinal column. It likewise does not impede our view. Ideally, the occlusal plane is recorded horizontally on the radiograph. This view of a dry skull approximates the angle and direction of the X-ray beam in the preceding radiograph. Note the unimpeded path to our areas of interest in the right maxilla and mandible. The inferior border of the left mandible affords no obstruction. The spinal column, which would extend downward from the foramen magnum, is likewise out of the way. We are now ready to demonstrate the technique for taking the standard lateral jaw radiograph of a dental office patient. The mid-sagittal plane should be vertical, and an imaginary line from the ala of the nose to the tragus of the ear should be horizontal. The headrest has been adjusted accordingly. An open-end cone, short or long, may be used in this technique. The vertical angulation of the head is set at 17 degrees upward. We are now ready to position the cassette. It should be placed between the headrest and the patient's head and be supported by the patient's hand. Rotate her head toward the cassette so that a 45-degree angle is formed with the sagittal plane of the body. Rechecking the position, we note that the sagittal plane of the patient's head is no longer vertical. If we adjust the headrest so that the pupils of the eyes are on a horizontal plane, the positional discrepancy is corrected. The horizontal orientation of the pupils assures a vertical sagittal plane. Now that the angulation with respect to the head is correct, we must center the cassette over the anatomic area to be radiographed. The first check is made from a lateral viewpoint. The red dot on the top edge of the cassette should be directly opposite the patient's eye. This governs the anterior-posterior position of the cassette. Viewing now from the front of the patient, note that the end of her nose is only 1/4 of an inch from the surface of the front panel. The horizontal center line of the cassette is now aligned along the patient's occlusal plane. The corner of the mouth serves as a superficial landmark. We are now ready to position the X-ray machine. The top edge of the cone is positioned just below the earlobe. The front edge of the X-ray head is approximately parallel with the top edge of the cassette. With a taut string, we check to make sure that the central ray will be directed through the patient to the horizontal center line of the cassette and film. In like manner, we check the alignment of the central beam with the vertical center line, designated by the red dot on the top edge of the cassette. When all the checks and adjustments have been accomplished, the exposure can be made and the patient dismissed. This is a right anterior lateral jaw radiograph. In this film, we wish to show the anterior teeth and their supporting structures from the midline back to about the cuspid region. Beyond this point, many of the structures are overlapped. The spinal column is at the right edge of the film. On this side, we see the body of the left mandible. It does not impede the view of our area of interest. This view of a dry skull approximates the direction of the X-ray beam in the anterior lateral jaw radiograph. Note the unobstructed view of the incisor areas, both mandibular and maxillary. Note also that the posterior teeth overlap. This is the left jaw, of course, and the spinal column would be about here, leaving a window, so to speak, for our view of the area. In positioning the patient for this film, the headrest is placed high on the head and adjusted so that, from a profile view, an imaginary line from the ala of the nose to the tragus of the ear would be horizontal. In a frontal view of the patient, the mid-sagittal plane of the head and body should be vertical. In profile again, the ala tragus line is rechecked. When this line is horizontal, the occlusal plane is likewise horizontal. The head of the X-ray machine is equipped with a short open-end cone. The vertical angulation of the X-ray head is set at 17 degrees upwards. The loaded cassette is inserted between the patient's head and the headrest at an angle of 45 degrees with respect to the sagittal plane of the body. The cassette rests on her collar and is supported by her hand. The patient's head is rotated toward the cassette until her nose is pressed against the surface of the front panel. This position must be maintained during the exposure. Viewed from the side, the anterior-posterior position of the cassette is aligned so that the vertical center line, designated by the red dot, is directly opposite the inner corner of the patient's eye. Again from the front, note that the tip of the nose is firmly pressed against the front panel. The horizontal center line should be aligned along the occlusal plane. The corner of the mouth serves as a superficial landmark. The X-ray cone is now positioned so that the central ray will be directed toward the film from just below the opposite earlobe. Note that the front edge of the X-ray head approximately parallels the top edge of the cassette. Here we see the positioning and direction of the cone from above and behind the X-ray head. Checking with a taut string, the central ray should pass through the patient and enter the cassette at the horizontal center line. Viewing from over the head of the patient, the central ray should pass through the patient and enter the cassette at the vertical center line, designated by the red dot. When the positions of both the patient and the cassette have been appropriately checked and adjusted, the exposure may be made, and the patient dismissed. This is a right posterior lateral jaw radiograph. In this film, we wish to show the lower molar area, the angle of the jaw, and the ascending ramus of the mandible. It is useful for investigating fractures, impactions, cysts, and neoplasms that occur in the region. On this dry skull, we're able to approximate the X-ray view of the ramus, the angle, and the posterior body of the mandible. The inferior border of the left mandible affords no obstruction, nor does the spinal column, which would descend in this area. Our objective is to direct the X-ray beam accordingly. In positioning the patient for this radiograph, the headrest is placed high on the back of the head. From a frontal viewpoint, the mid-sagittal plane of the head and body should be vertical. Viewing the patient from the side, an imaginary line from the ala of the nose to the tragus of the ear should be horizontal. The X-ray machine may be equipped with a short or long open-end cone. The vertical angulation should, in either case, be set for 17 degrees upwards. The prepared cassette is now inserted between the patient's head and the headrest at a 45-degree angle with the sagittal plane and supported by her hand. The patient's head is rotated toward the cassette until the end of her nose is approximately 1 1/4 inches from the front panel. The horizontal center line of the cassette should be aligned with the occlusal plane. From the side, the red dot marking the vertical center line should be midway between the ear and the eye. The front edge of the hairline is usually a good landmark. Checking the position of the cassette from a frontal view, note again that the patient's nose is fully 1 1/4 inches from the front panel. The corner of the mouth, which serves as a landmark for the occlusal plane, is directly opposite the horizontal center line of the cassette. The X-ray cone is now positioned below the opposite earlobe. The front edge of the X-ray head approximately parallels the top edge of the cassette. The central ray should be directed through the patient toward the center of the film. The direction of the central ray may be checked with a taut string to assure its precise alignment with the horizontal center line. Viewing from over the head of the patient, the central ray should pass through the patient in direct alignment with the vertical center line of the film. The red dot on the top edge of the cassette acts as a guide. When the positions of both the patient and the cassette have been appropriately checked and adjusted, the exposure may be made and the patient dismissed. This X-ray is specifically designed to exhibit radiographically the condylar process of the mandible. We are tracing the posterior border of the ramus up and over the head of the condyle and down anteriorly to the neck. It is in this area where condylar fractures are most frequent. This is the fossa in which the condyle rests when the mouth is closed. This is the image of a maxillary molar on the same side as the pictured condyle. This radiopaque structure is the greatly enlarged image of a maxillary molar from the opposite side. The structures from both sides are actually recorded, but only those from the one side are clearly defined. Although the preceding radiograph was of the right side, we will use the left side of the dry skull to illustrate several points. With the teeth in occlusion, the mouth is closed, and the head of the condyle rests in the articular fossa. As the mouth is opened, the condylar head moves down and forward to rest on the articular eminence. This is the vacated fossa, and this is the articular eminence upon which the head of the condyle now rests. At this point, the mouth is fully opened. It is in this position that our radiograph is exposed. In preparing for the exposure, the patient is seated in the chair with the headrest adjusted rather high on the back of the head. From a frontal view, the mid-sagittal plane of the head should be perfectly vertical. In profile, the head should be positioned so that an imaginary line from the ala of the nose to the tragus of the ear is horizontal. For this radiograph of the mandibular condyle, the cone is removed from the head of the X-ray machine. The vertical angulation of the X-ray head is set at 5 degrees upward. To direct the beam, we need to know the position of the mandibular foramen. We trace directly along the occlusal line on this X-ray and find that the mandibular foramen, indicated by the arrow, is directly in this plane. In a vertical orientation, we note that the foramen is located midway between the posterior border and the anterior border of the ramus of the mandible. This foramen is the target of our central ray for this exposure. To locate the foramen on the patient, we palpate the borders of the ramus, visualize the vertical midline between them, approximate the occlusal line of the mandible, and place a red dot at the intersection of the two lines. Since we do not have the cone to help in positioning of the X-ray machine, we will use red dots to aid our visualization of the central ray. One dot has been placed vertically above the center of the aperture, and another is placed on a line directly horizontal to the center. Here we see the orientation of the red dots as viewed from directly in front of the aperture. Since we're going to radiograph the left mandibular condyle, we have placed the dot marking the horizontal on the left side. All marking dots are now visible. The head of the X-ray machine should be positioned so that the central ray will be directed precisely toward the red dot marking the right mandibular foramen. The front of the machine should be aligned parallel to the mid-sagittal plane of the patient's head. The cassette will likewise be placed approximately parallel to the sagittal plane. It is centered over the condyle and supported by the patient's hand. Clear definition of the left jaw structures is possible because the superimposed right side is relatively close to the X-ray source, whereas the left side is close to the film. The mouth is now opened and kept in that position while the exposure is made. The patient may now be dismissed. These are two radiographs of the right temporomandibular joint. The radiograph on the right was taken with the mouth closed. Note that the head of the condyle is resting in the articular fossa. Anterior to the fossa is the articular eminence. Posteriorly, the external auditory canal and the mastoid region. When the mouth opens, the condylar head in its capsule will vacate the fossa, sliding forward and down to rest directly below the articular eminence. This is its position when the mouth is fully opened. On the dry skull, we may illustrate these positions. Here the teeth are in occlusion. The mouth is closed. The condylar head rests in the articular fossa. No intracapsular space exists, of course, as it does in the living specimen. The condyle slides forward and downward as the mouth is opened. The articular fossa is now visible, and the head of the condyle rests just below the articular eminence. Two X-ray cones are shown here. Each is equipped with a lead diaphragm of the same diameter and thickness. The central aperture of the cone on the left, however, is quite large. The aperture of the cone on the right is much smaller, about the size of a dime. We use such a diaphragm for a radiograph of the temporomandibular joint. Constriction of the X-ray beam exposes a smaller volume of tissue, and the amount of scatter radiation is reduced. Since scatter radiation tends to fog the film, use of the small diaphragm is desirable. The small diameter beam requires careful positioning, however, because accurate projection is absolutely necessary. With the cone in place, the vertical angulation of the X-ray head is set at 25 degrees downward. The patient is seated in an erect position, and the headrest is adjusted quite high on the back of the patient's head. In a frontal view, the mid-sagittal plane of the head should be perfectly vertical. In profile, an imaginary line from the ala of the nose to the tragus of the ear should be horizontal. To aid in positioning the X-ray cone, we have prepared a ruler, which is 1 inch wide, by placing a red dot on the scale edge at 2.5 inches, and another dot at the end, but at the edge opposite from the scale. With the red dot of the scale edge just above the external auditory meatus, the ruler is held in a vertical position. The dot at the end of the ruler marks the precise point at which the central ray should enter. Using the dotted ruler, we have now positioned the cone so that the X-ray beam is directed to enter the patient at a point 2.5 inches above and 1 inch posterior to the external auditory meatus. We must now check the direction of the beam with relation to the left temporomandibular joint, which is to be radiographed. With the patient's finger on the joint, a taut string is used to affirm the projection. The direction of the central ray must be checked from this angle as well. With the finger again firmly pressed against the joint, the line from the top edge of the cone is visualized to project precisely through the left temporomandibular joint. The loaded cassette is now positioned parallel to the front edge of the X-ray head and centered over the temporomandibular joint. It may be supported by the patient's hand during the exposure. For this radiograph, the patient held her jaws in a closed position. As an alternative to the patient supporting the cassette, a simple mechanical device is available that does the same job. The cassette is appropriately positioned, and for this radiograph, we ask the patient to hold her mouth fully open. The exposure is made, and when the equipment is moved away, the patient is dismissed.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.